Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today here with Dr. Millicent Ravello. How you doing, Dr. Ravello?
I'm doing well. How are you?
I'm good. It's a Saturday.
It is, yes.
And we are finally able to record in the same room, which has not happened for a very long time.
It hasn't. The holidays have not been good for the Beverly Hills Plastic Surgery Podcast.
It's been a lot of Zoom calls.
It's been a lot of Zooms. We've been in and out of town and holiday madness, but we're back. We're back to business, and we are excited to be here.
Awesome, because we have a very important topic that comes up over and over again and over again.
And over again.
With our patients. They all want to know, after plastic surgery, when can I have sex?
It's the most common question, and I can always see it coming, and it makes me giggle every time because I'll see them like at their post-op, day 7 or 2 weeks or whatever it is, and they're doing well and like things are progressing well, and usually I'm like about to leave the room, and this like funny look sort of comes over their face, and I know it's coming, and I'm just like, wait for it. They're like, So my husband wants to know when we can have sex again.
Totally. It's always that.
It's always.
My husband wants to know, when can we have sex? And it comes up in every procedure.
Every procedure.
And it's different for every procedure, by the way.
It is. That is true.
So let's start with the common procedures, the common operations that you might go, maybe sex isn't a good idea right now.
Well, let's go top to bottom.
All right. That's a good way to do it. Starting with facelift and rhinoplasty and any other chin implants, things like that, your facial aesthetic surgery. Typically, I tell them to wait at least 2 weeks.
At least 2 weeks. Just because there's going to be some moving around and some bumping and some, movement that may or may not be good for a swollen face, fresh incisions, bruising. So after 2 weeks, your incisions are basically healed. The bruising has gone away. The swelling is starting to come down. So you're less likely to hurt anything in that immediate, fresh post-op time period.
Yeah, at least 2 weeks. 3 is probably better, but I always say, look, don't go nuts.
Yeah.
This is not the time to win awards on new ideas that you have.
No.
Let's go with something really basic and easy so that you don't shear your facelift flap. You don't cause because your nose will bleed. You can bleed 2 to 3 weeks after surgery, after a rhinoplasty, for sure.
For sure. Well, another thing, too, is you don't want to bump your nose because you could definitely break it in a way that it's not supposed to be broken because those bones haven't healed in place yet. So nothing where you could potentially break your nose. So no positions that could put your nose in danger.
Yeah, do not try anything fancy.
Yeah.
After plastic surgery, you want stuff to heal. But we also get you want to have sex.
We get it.
We get it.
But this is probably one of those procedures out of all of them that we do. And if we're going to get really specific into the types of sex you can have, I would say maybe don't perform oral sex if you've just had a nose job, because that's going to be a lot of stuff banging around your nose.
Oh, man, for sure.
So if you want us to get really specific about what you can and can't do, don't do that.
Exactly. Yeah, you got to be careful. You want to protect your operation. So that, and I do say that. I say, look, you got to just use common sense and don't do anything that's going to jeopardize your operation. We understand that sex is normal and natural, and we get it. But at the same time, please protect your operation.
Please be careful. And then that brings us to the breast. And this is the hardest one, I think, because people get really, really, really excited about their new breasts. And from a recovery standpoint, it's usually not that bad. A day or two of pain, and after, a couple days, certainly by a week, from a pain standpoint, you're feeling okay. And people, again, are really excited about trying out these new breasts.
I have a little story about that. I got the phone call after doing a breast augmentation at about 2 a.m. that there was a problem. And the problem was, well, doctor, the problem is that we were having sex and all of a sudden one of the breasts that you just did today started blowing up like a balloon. I was like, where in the post-op instructions did it say to road test the breast augmentation the night of surgery?
No, nowhere.
No, it did not say that.
Not a good idea.
So anyway, they came in, drained the hematoma. I was like, dude, take it easy. I understand you paid for these and you're excited, but like, they need to heal.
They need to heal. And there may be some consent issues because she's still under the effects of anesthesia.
So true.
She is not in a position to make good judgments.
Yeah, she's like got 6 Percocet in her. Like, no, this is not the time for this. Back off, buddy. So yeah, in terms of road testing the breast implants, I'm sort of 3 weeks is great. Sometimes I know it happens at 2 weeks, though. I can tell.
And for sure, it happens at 2 weeks.
Yeah,
like,
I
no
know.
doubt it happens at 2 weeks. 1 week for sure. 2 weeks if you are taking it light. 3 weeks would be ideal. And the way I sort of explain it to my patients is that I think of it as a light physical activity. So at the same time where I tell you, yes, you can now maybe start doing some incline walking on the treadmill or some light elliptical work.
Right.
That's when you can start having sex. So think about it in the same way. Something that's going to be a little bit cardio, but nothing too intense. So when you're ready for that, then you're ready for that light sex.
Yeah, I think that's the key. I mean, by 6 weeks, you can kind of go gangbusters.
6
and it's
weeks,
okay.
you're fine. Like,
Yeah.
do your thing.
Right, but you got to let it
You got to let it heal. And then that brings us to the tummy tuck.
I want to back up for 1 second
Oh,
before
sure.
we do the
Sure,
tummy
sure, sure,
tuck,
sure.
because I have a little story about a buccal fat excision that I did.
Oh, okay. We're back to the top. Okay.
Because you would think with 2 big wounds in your mouth, but they're not that big. They're about 1 centimeter. So a buccal fat excision, which is a great operation, go in through the gums, the bite line, take out the buccal fat pads on each side, and you put some stitches in there, right? But it needs to heal.
Yes.
So I had a bleeding episode 5 days after surgery from oral sex after a buccal fat excision. And I was just like, but didn't you think, like, that's going to hurt or that it might disrupt the sutures or...
No.
No. It's just like, well, you know, I felt okay.
She felt good, and what could go wrong?
Bleeding like all get out. Like, it's just terrible.
That's not sexy.
So yeah, so we cauterized it, put some stitches back in, and I said, look, you have to like back off. You like think of something else.
Other things that
There's
you
other,
can do.
like do something else.
Yes.
Let this heal, please.
Yes.
Let it
Keep
heal.
objects away from the inside of your mouth. Thank you.
Now we can go to the abdominoplasty.
Okay, now back to the abdominoplasty.
Because this one's a little tricky.
This one's, for sure, out of all of them, the one where it's probably going to take the longest. Because certainly that first week, you know, you're already going to be in a weird positional issues. Because I'm sure we all do.
you
We
have to
tell our
stay
patients
flexed.
to walk bent over. When you're sleeping in bed, you have to be in a beach chair reclined position. And it hurts. We do a lot of work on the stomach muscles.
Your core is
a lot
totally
of
tight.
liposuction everywhere. So there is a lot of stuff that's happening in the core of your abdomen. And you're just not going to feel up to it for, I would say, a couple of weeks. Like, you as the patient are not going to feel up to it for a couple of weeks. No, I could be wrong. There may be some people out there that are up for it a lot earlier. But that being said, from a safety standpoint, I would say at least 3 weeks. And then it's super light.
Yeah, because you have sutures up and down your muscles of your abdomen. And you got to just think it through on
You
this
gotta
one.
let those things heal on the inside.
Let it heal.
And the other thing too, and depending, you may have drains, which, you know, you certainly don't want to get entangled in those. And then the swelling factor. If you don't have drains in and you start increasing your physical activity, you can create shear, you can create friction. All of that builds up fluid, and now you have a seroma that has to be drained. So all of these things, one of the hardest things to do is to be a patient when you feel fine, but you have to let your body heal internally before you can really get back to any of these things.
Yeah, I mean, that abdominoplasty is a big one because it is, you know, and you're not going to rip the sutures out. It's going to feel that way. You know, if you yank too hard on your abdominal wall,
But
I don't think you're going to tear them out.
I have seen some hematomas that I think have come. I had a patient tell me specifically, she's like, yeah, I was feeling pretty good. So I was going up and down stairs and doing laundry at like 2 weeks or 3 weeks after her surgery. And sure enough, she came in with a lower abdominal hematoma. And we put interrupted sutures when we do those muscle plications. And so if one of those muscle plication sutures tears, it's going to create bleeding in the muscle.
Yep.
So you could have some delayed bleeding.
Yeah, I mean, those things do happen because it's usually when you've overdone it.
Yeah.
You've overexerted yourself, and sex is definitely an